Okay, so we talked earlier about the loss of fat and elasticity that can occur with the semaglutide and the tirzepatide called Ozempic Face. You've probably seen it in people in Hollywood looking so different, don't look like themselves anymore. So like we said earlier, we recommend people, to take extra care of their skin, to lose weight gradually. But if that happens anyway, that people lose the skin, the elasticity in their skin become loose. So we have different machines that we use and different treatment that we use to tighten up the skin, like the Scarlet that we talked about earlier. It's a microneedling with radio frequency that will go and tighten up the skin at the dermal level to help lift the skin. As well as we have a program here using what they call a biofiller. Instead of using a commercial filler, we take up the person's blood, we separate the serum from the red blood cells, the plasma, that's called the plasma, it's a serum, and then we pretty much spin the serum into one of our devices here that will turn it into, we put it in heat and cold, and it turns it into a gel. So it comes to consistency, an actual filler, and we put the platelet-rich plasma in there, and we re-inject it in the face. So it does two things. It gives you an immediate result where you see your face plumped again, and at the same time, you have growth factors infused in there, your own growth factors that are going to help rebuild the collagen that you've lost. And also we pair that with skincare, that also will tighten up the skin using different modalities and different products to rehabilitate the skin from the loss of elasticity. Well, if you use a filler off the shelf, pretty much a commercial filler, it's a lot more expensive, and also you do not have the growth factors in the filler. The filler is just a filler. It's going to come in and it's gonna do its thing, and then it eventually dissipates and it gets absorbed over a few months, or it depends on the person, over maybe a year or two. But using your own blood, it's for certain people who are not sure that they want fillers. They want to see first what they look like with fillers. So it's more natural, and it's your own blood, and it also has the growth factors that you're not going to get from the fillers. Now we have what they call biostimulator, like Sculptra and Radius, that we can also use, that will make your body make the collagen that it's a biosynthesis of collagen. It's a biomodulator that makes you make collagen. So that's another type of filler-ish that you could use. Well, anyone who has suffered from loss of elasticity for different reasons, whether it's weight loss from the weight loss GLP-1s, or cancer treatment, or stress of life, living in Florida where we expose so much sun, and that also breaks down your collagen. So yeah, so that would be the right person for that as well.